everybody. Let's get going. So, my name is Amit Shafrir. This is me now. This is the outcome of COVID for me, another 30-pound gained. I come from a small village in the north of Israel, but now I live here. Well, not exactly here, but nearby. I have a long history in consumer tech, many brands, and now I am with Itamar Medical, and I focus on medical devices and digital health. Itamar develops a solution that enables the diagnosis of a disease called sleep apnea at home, a disease that over 50 million Americans suffer from. The vast majority are undiagnosed. I'll get back to it. So, before we can explain what happened during COVID, I have to provide some context. It took the medical profession a very long time to adopt simple things that we think of today, like the stethoscope. Everything is slow. This is not a joke. You know, physicians want evidence, and evidence takes time. What we've seen in the past years with the COVID vaccination are record times that haven't happened in the past. Physicians are risk averse. They don't like change. They remember their oath. Now, I personally am focused on the US market, but regulations are everywhere. From taking a slow approach to the approval of drugs and devices to protecting patients' privacy, there are a lot of regulations, a lot of them to make sure that the business of medicine is practiced without kickbacks and bribes, a lot of regulations. And last but not least, people inherently want to be treated by people. We are built this way, we're wired this way. So these are the reasons why things in medicines are slow. A short dictionary to make sure we understand what I'm talking about. In the US healthcare system, there are three big elements. Providers, who are the doctors, nurses, hospitals, etc. Payers, who are the various private insurance companies and the government, CMS, Medicare. And of course, there are patients. Patients receive service and treatment from providers, and providers receive reimbursement or payment from payers. All right, getting to talk about telehealth. What is telehealth? It's more than just virtual visits, doing a visit over the phone. When we say telehealth, we're talking about the interactive electronic exchange of information for diagnosis, intervention, or care management. We're also talking about different modalities or channels of communications and different endpoints, both patient to provider and provider to provider. We've had huge movement like globalization, and we've had digitization. Right now, we're in the middle of dispersion. And what is dispersion? It is the ability to distribute products and services over a wide area and where and when they are needed most, removing unnecessary friction and cost. So this is a major, major paradigm shift. But let's focus just on the dispersion of healthcare. The core value that a company offers is being dispersed to the end consumer and is skipping the traditional channels of distribution like stores, movie theaters, and health clinics or hospitals. And I believe this is the biggest trend in business that will create the largest shareholder values. Think about this number. Healthcare is about 18% of US GDP. That's $4 trillion. Again, $4 trillion. And it's estimated that just in 2021, this year, about $250 billion, that's again, $250 billion, a lot of zeros, will be moving healthcare from clinics and hospitals to people's homes. And never in the history of mankind has so much money been put towards this goal. Guess what? The world's top companies are getting into healthcare. They have no choice. Just follow what companies like Walmart are doing, deeper and deeper into healthcare. Amazon will seize over $100 billion, I'm talking about huge numbers here, $100 billion of market capitalization value from top healthcare firms. And just imagine, the Amazon delivery truck also comes with a nurse who will administer my COVID-19 vaccine and also give me a diagnosis device. But I digress. All right. So, enter COVID-19, also known as the novel coronavirus. So what happened? 4 things. People were sheltering at home. If you can remember, not far ago, we were all sitting at home. Many clinics shut down, and many hospitals did emergency work only. We needed to find ways to protect patients from getting infected, and of course, we needed to protect the doctors and nurses and other healthcare providers. So all of this happened not too long ago. Remember I talked about the big dispersion? So COVID acted as an accelerant rather than a change agent, like pouring oil on an existing fire. And I had a first row seat to see this impact because my company, Itamar Medical, is right smack in the middle of this paradigm shift as we provide diagnosis to the home. We have done over 50,000 what's called contactless deliveries to patient homes in 2020. That is 50,000 patients that we help that didn't have to leave the home to get a medical service. And 2020 was nothing compared to what's happening in 2021. So, if anyone in the audience is contemplating a startup in the digital health vertical, there's never been a better time. It's telehealth. All right. Telehealth, I'm going very fast because I'm trying to get a 45-minute presentation into a 25-minute time slot, so I apologize. Telehealth has proven itself to be an essential means of care delivery during COVID-19. For COVID patients, telehealth allowed providers to assess the symptoms, we heard about it from Dr. Jan before, assess symptoms and need without actually bringing patients into a clinic before it's absolutely necessary. This limits the risk of exposures to others, including providers. For non-COVID patients, telehealth is potentially the only way that they're able to interact with a clinician. They don't have to risk exposure, and they're able to continue monitoring or address urgent or even emergent needs. And for clinicians, of course, I mentioned it allows them to connect with patients without risking exposure to themselves. It also allows those clinicians who were exposed or were ill to continue and provide care without risking exposure of others. So altogether, Forrester estimates that there's been over 1 billion telehealth visits in 2021. 1 billion visits in 2021. And of course, many organizations are playing catch up. Just so you know, in January 2020, before COVID, only 1 in 4 healthcare organizations had a virtual care program, had even the ability to provide virtual care. I'm talking about the US. All right, so what's happened? What's happened last year? We'll start with regulations. So to help stand up telehealth quickly, CMS, that's Medicare, that's the US government, has relaxed the where, how, and with whom patients can access virtual care. For example, patients can access telehealth from home. Big deal. Restrictions on home access to rural areas are lifted. So before, you could only get it if you were in a rural area. Now, anywhere, regardless of where you are in the States. Visits can occur at home. New patients can get telehealth. Before, only existing patients. Now you can have new patients get telehealth. Telehealth visits can occur over smartphones and other what we call everyday communication platforms. So you don't need a special system or software or device. You can use FaceTime or Skype now. This wasn't permitted before. Providers have the agency to reduce or completely waive copays. Remember, money drives the medical care in the US. They can waive copays or deductible without running afoul of regulations. It also allows to do audio only. So think about elderly people who are not that able to use a video phone and stuff like that. Guess what? You can do a telehealth phone call with a physician now. Medicare is allowing eligible providers to use telehealth, all of them, not just doctors. It could be nurses, it could be physical therapists, speech therapists. Everyone who provides a medical service can now do telehealth. And these changes were critical because the private payers in the US follow the Medicare lead. Now, currently all these changes are temporary, just for as long as the crisis is around. But the question is, will they become permanent going forward? Hospitals' initial focus for telehealth has been to respond to COVID-19. That's right. Again, it seemed like a long time ago, but it was about 15 months ago, 16 months ago, when hospitals needed to figure out how do we handle all this COVID-19. And they focused on two areas that are perfectly suited for telehealth. First, they've been deliberate about informing patients that virtual tools exist. This is the number one problem. Patients don't know. The fact that you have something and no one knows about it means nothing. So they've been focusing on marketing and letting patients know that this exists. And second, it's being used for initial triage, acting as a front door to health systems to make sure that only those who actually need to physically be somewhere get in. Here are a couple of examples. And I think Dr. Yan mentioned chatbots before as well. This is an example from Providence Health in the Pacific Northwest of the US. They took a tool they already had, a chatbot they called Grace, and they worked with Microsoft to update Grace in a record time at the beginning of COVID to do triage for patients. But they didn't just upgrade the tool. As I mentioned before, they made sure that people could find it. They invested a ton of money in marketing it so that people know where that chatbot is. And once a patient accesses the tool, the first thing that they see are FAQs. You know, if you remember at the beginning of COVID, we knew nothing, mask, not mask, distance, there was nothing. And everybody said, oh, I'm sneezing, oh, I've got COVID. So they created the FAQs, and that was the first level. You know, look at the questions, get the answers, okay, I'm fine. Moving down up the pyramid, users who are experiencing symptoms take the assessment. Again, today it all seems normal to us, but at the beginning of COVID, this was non-existent. The chatbots then ask them a series of questions designed to figure out how severe the problem is. Mild cases are directed to self-care, and then, if necessary, it goes to a nurse practitioner who figures out whether or not they should come in. So again, all done with a chatbot. Another example. We see creative uses of telehealth popping up. Here's an example of how telehealth technology was used in an acute care setting. This is from the Sheba Medical Center in Israel. I'm sorry I'm talking about Israel. I'm doing some shameless Zionist propaganda here. And it was tasked with preparing for some of the very first COVID patients coming in off some cruise ship. They worked for a few days to set this whole thing up. And so first, patients were directed to self-care. And remember, this is all novel. Today, we're already used to it. But at the time, in February of last year, it was new. They didn't have a teletriage process. So this was done at the hospital. Patients who were isolating at home, the plan was to give them a Tyto home exam kits, which I'll show in a second. Patient with COVID-19 was treated in a field hospital, separate from the main hospital building. They received care through a robotic telemedicine cart, which they have found patients learn to use very quickly, again, so that physicians would not get close to the patients. Even older patients could use them effectively. And Sheba has rolled out virtual trainings, etc., from that time. And all the collected information from the patient through that cart came into a dashboard that doctors were using internally.
When your family is sick, you want all the information you can get. And we know getting to the doctor isn't always easy. That's why we created Tyto, your on-demand medical exam that connects you with your doctor anytime, anywhere. With Tyto, your doctor can examine you and your family from home to diagnose and treat many of the most common conditions, such as ear infections, colds, sore throats, fever, cough, congestion, and rashes. It includes an app for communicating with your doctor and the Tyto device for conducting exams. The device has an easy-to-use touchscreen that guides you through the examination process, and special adapters for examining the heart, lungs, ears, throat, skin, and taking body temperature. Let's see how it works. Michael's woken up with dizziness, a cough, and a fever. His mother, Caroline, requests a live examination with a physician. Dr. Johnson is on call and begins the consult. The doctor can see and talk with Caroline and Michael and guides them through the specific exams she'd like to perform. In this case, she examines his ears, throat, and heart. Results appear instantly on the doctor's screen, so Dr. Johnson can listen to and see the exam results in real time. Alternatively, Michael's mom can use Tyto to capture and send exam data to her doctor prior to the consult using Tyto's guidance technology that ensures both accuracy and ease of use. Having diagnosed an ear infection, the doctor submits Michael's prescription to the pharmacy for pickup. Michael is spared a late-night visit to the ER, and his mother has peace of mind that he received the right diagnosis and treatment, all from the comfort of home. Always know with Tyto, your on-demand medical exam.
I don't have any shares in Tyto, but I really think this is a cool technology. All right, so I'll talk a little bit about Itamar Medical. So Itamar Medical develops a device that allows patients to diagnose for sleep apnea in the comfort of their home. There are over 50 million American patients in the US who have sleep apnea, and most of them don't know it, which is a shame because it's a treatable disease. So, before COVID, most sleep tests have been conducted in sleep lab. You go into a lab, a whole lot of tubes and wires are connected to you, and you're asked to go to sleep. With Itamar's device, the watch pad, you put it on your hand, you put it on your fingers, and you go to sleep at home. So usually, again, pre-COVID, 2/3 of all sleep studies are done in the sleep lab, 2/3. COVID came around, guess what happened? Those sleep labs were shut down, and the AASM, the American Academy of Sleep Medicine, recommended that sleep tests be done at home with a disposable single-use device. So things flip. All of a sudden, 70% of tests are done at home, which we believe in the long term, it'll be probably something like 50-50. We'll see what happens. But again, major impact of COVID on this kind of an industry. The other emphasis was on full telemedicine, so and contactless deliveries. Telemedicine consult is done, the patient receives the device through the mail, delivered, does the test at home, receives the results, go back to their physician, and if a treatment is necessary, the treatment device is sent over to the patient. All of this is done with the patient and the physician never leaving their own home. All of this is done. And this is now really cool.
This drone is delivering COVID-19 supplies to a nearby hospital.
Seeing the first flight was exhilarating.
The drones will carry about 4 pounds of personal protective equipment and fly up to 30 miles round trip.
Airspace is clear.
Previously, the FAA only allowed drone deliveries within 2 miles.
To be standing in one of our major hospitals and see a drone drop exactly where it was planned to drop, PPE, and watching our public safety officer pick it up and carry it in, that was very satisfying.
Novant Health is a network of 700 locations, including 15 hospitals. During the pandemic, the group is rethinking how to distribute medical supplies.
Everyone here has heard about the PPE challenges. We are fortunate in that we have a good supply, but one of the things we'd like to do is be able to deploy that PPE when it's needed in a more surgical fashion. We can do that through drone-based delivery.
To make drone deliveries a reality, Novant partnered with Zipline, a California drone delivery company that's been operating in Africa for years.
We operate serving about 25 million people in East and West Africa. We deliver 160 different medical products to hospitals and health facilities on demand using drones. Today, Zipline delivers around 75% of the national blood supply of Rwanda.
We've been working with Zipline for over a year, putting our toe in the water related to drone-based delivery of PPE, clinical supplies, etc. When the crisis started, we were able to very quickly pivot and accelerate some of the work.
The goal is to efficiently distribute medical supplies like masks and vaccines across Novant's network of hospitals and clinics. But the company says that goal is still a long way away. For now, the FAA's approval is only temporary, and the drones are currently serving just 2 of Novant's hospitals in North Carolina.
It's really exciting because I think we're going to have flights going farther and over people much more than the FAA has been willing to allow in the past.
These drones may provide a peek into what the future of healthcare could look like and how hospitals might react to pandemics in the future.
Once I think the FAA sees that this can be done safely, can be done without any incident, without any harm to people or property on the ground, I think they're going to be more willing to open up other types of delivery.
We're going to learn a lot about public appetite for drone-based delivery, the significance of the impact it can make on our operations, and the speed of on-demand delivery of critical supplies, and that impact on the health of our patient population.
Hospitals are looking for ways of extending the reach of the healthcare system, delivering the products that those patients need at home, as opposed to needing to travel to get it. So this is one really big way that autonomous delivery can be incredibly helpful in this time.
This is really cool. Since that was shot, Zipline was also delivering COVID-19 vaccines to certain area and, of course, COVID tests. So, with all this, just a temporary thing, and we'll all go back to where it was before. So this is what McKinsey is saying. There are 2 big issues to understand. One is reimbursement and what expanded telehealth will mean for providers, right? This has been the world's largest real-time live test of what telehealth could be due to COVID-19. So first we have to be honest. Reimbursement parity for telehealth is critical. What this means is physicians and providers need to know that they get paid the same if they see a patient in the clinic or if they see him online. Otherwise, it will never work, and I think this is where we're going to. Second, it's very important to understand the downstream implications because they can be transformative. You know, if those millions of people who tried telehealth for the first time during COVID, who maybe before I'd never do it, we know how generally we as humans are adapting to technology and to new things. If that happens, we're going to see a huge difference. It's going to be transformative, and there's not going to be, we're not going to go back to the way we were pre-COVID. It also opens the door for providers to reinvent care standards and pathways to incorporate telehealth. It will mean wrestling with more issues of scheduling, downstream interaction, etc. There is a lot to be done here, but I don't believe we're ever going back to where we were before. Let's consider the following. Reimbursement. So right now, again, I'm running through this really quickly. Right now, providers and systems are making plans for this new world. They're making plans and they're trying to figure out what is going to be the demand and how much is it going to be required. And the most important question that they have is, will telehealth replace traditional or will it be an addition? This is the biggest fear that payers have is, oh, now we're going to have to pay for this and that. We're going to still have to have all these hospital buildings and offices and clinics, and we're going to have to pay for that. So these are big questions. A lot of the answers were provided, the data was provided during COVID and is being analyzed now. So first, telehealth can't be a side hustle. This is important for if anyone here is a provider. It can't be something that we give to a little group on the side saying, take care of our telehealth. No. Telehealth is mainstream. It's a critical part of what a provider provides. It needs to be at the top of mind. It needs to be what the CEO of the health system is looking at, not a little side gig, which it was for many organizations before COVID. Now, a word of warning here we need to remember. Telehealth is great for a lot of people like us who have means, who have ability, who can use phones, who have access, who have resources. But the truth is that these solutions rely heavily on technology, which is often out of reach for many populations that are already underserved. So when we move forward to telehealth, we need to make sure that we don't have it just for the top 10%, but we are having solutions that are broader and that can serve anyone, because everyone deserves quality health care. We'll have to demonstrate the utility to clinicians. Historically, their main concern was reimbursement, but there was an AML survey that they were concerned about that. American Well is a big American company. But the explosion of the interest and use of telehealth is providing a national demonstration case, or trial by fire, as we call it. Clinicians are learning right now in real time what it is like, what are the good, what are the bad, what are the challenges, and this would never have happened this way without COVID. Remember, I told you at the beginning how conservative people are. It would have taken a decade to get to where we got through in 1 year. I have two examples. Incorporating telehealth and technology into a new kind of care delivery experience. 98.6, not sure if you heard about that one. Another very interesting startup. It's an officeless practice. They don't have any sort of physical clinic, no building, nothing. They pair artificial intelligence, which handles administrative components like visits, provides an initial diagnosis and treatment recommendation, and asynchronous telehealth, basically text messaging. You send back and forth and you get that information. Ultimately, this AI platform is responsible for 90% of the tasks associated with a traditional visit, only requiring the physician to complete the final diagnosis, look at everything, and the care plan. This streamlines clinical workflows. It expands clinical capacity, and it's convenient for the patient. The one missing component from many virtual platforms, though, is the ability to complete a physical examination. I think we've seen before how that was done with Tyto. So Oxner in Louisiana partnered with American Well for its virtual care. They partnered with Tyto Care. Everyone gets this device to do the physical test at home, and together they can provide the full in-clinic equivalent. I won't say full, but as close as can be. On-demand virtual care, urgent care, is an alternative to lower acuity emergency department visits, urgent care visits, and after-hour consultations. Virtual office visits with an established provider for consults that do not require physical exams or concurrent procedures. There's near virtual office visits extend the opportunity for patients to conveniently access care outside a provider's office by combining virtual access to physician consults with near home sites for testing and immunizations, such as worksite clinics or retail clinics. Virtual home health services leverage virtual visits, remote monitoring, and digital patient engagement tools to enable some of these services to be delivered remotely. They're home to improve their strengths, balance, and endurance, and to advise them how to avoid physical hazards to reduce risk of fails. All right, almost done. Telehealth will be an essential part of care. Here's a quote from Seema Verma, the administrator of CMS. This is a clear statement, as we have seen, about the ongoing transformation of telehealth coming out of COVID-19. There's no going back. I want to remind you again, $4 trillion. That is how much is spent on healthcare in the US. COVID-19 has shown us that perhaps, we're not spending this money in the right places, on the right products and services. My name is Amit Shafrir. Thank you very much for your attention.